Hey everyone, let me share something that's been weighing heavily on my mind lately. The growing crisis of nurses leaving bedside nursing. You know what's particularly heartbreaking? One of the major reasons nurses are walking away is the verbal abuse they face daily. I remember Sarah, a dedicated ICU nurse with 15 years of experience who finally reached her breaking point last year. She dealt with life and death situations, grueling night shifts, and endless paperwork. But what ultimately drove her away? The constant barrage of hostile language and disrespect she faced from both patients and, surprisingly, some colleagues. But here's the thing, this isn't just about hurt feelings. When experienced nurses leave bedside care, it creates a dangerous domino effect. New nurses are thrown into high-stress situations without proper mentorship. Patient care suffers. The remaining nurses become overwhelmed, leading to more departures. The statistics are alarming. Studies show that nearly 70% of nurses have experienced verbal abuse in their workplace. Think about that. These are professionals who dedicate their lives to helping others, yet they're treated with such disrespect. What many people don't realize is that nurses aren't just medical professionals. They're human beings who carry emotional burdens home with them. When you combine the stress of literal life and death situations with constant exposure to hostile language and verbal attacks, it creates a toxic environment that's simply unsustainable. And let's talk about the broader impact. Every experienced nurse who leaves takes with them years of invaluable knowledge and expertise. That's knowledge that could have been passed down to the next generation of nurses. Instead, we're seeing a growing experience gap in healthcare that's becoming increasingly difficult to fill. The solution isn't simple, but it starts with awareness and respect. Hospitals need better policies to protect their staff. Patients need to understand that while they're going through difficult times, verbal abuse is never acceptable. And perhaps most importantly, we need to create a culture of support and dignity in healthcare. Because at the end of the day, if we want quality healthcare, we need to keep our experienced nurses at the bedside, and that begins with treating them with the respect and dignity they deserve. Remember, behind every nurse is a person who chose this profession to help others. Let's help them continue doing what they do best, saving lives and making a difference.